None of us ever imagined that we would be living through a pandemic. We always knew it was a possibility, but it just never seemed like it would ever happen to us. And while our medical community is on the front lines, helping to treat patients amid all the uncertainty, many of us have been wondering what we can do to help out. Hey, how's it going everyone? It's Ernest from Trip Astute. In this video, I want to share some things that you can do to help with fighting the impact of the COVID-19 pandemic. This is a very strange time for the channel, especially since travel is mostly disrupted right now. While we had some travel related videos in our pipeline, I just don't think that they're relevant now, given that a lot of us are staying home and avoiding contact with others. So today, I wanted to do a video on things that we can do to help with the pandemic. I know many of you have been affected by the virus, both physically and economically. As a society and community, it's time for us to come together and help one another get through this challenging and dark time. The first thing you can do, which is probably the most important, is to follow proper hygiene and physical distancing guidelines. You'll notice that I'm using the term physical distancing and not social distancing. That's because it's the new terminology used by the World Health Organization, since there seems to be some confusion with the term social distancing. These guidelines aren't just for those that are sick, it's actually more important for those that are not infected in order to prevent and slow the transmission rate of the virus. You all are probably well aware of the phrase flattening the curve. This is critical for us to achieve in order to reduce the strain caused by a rapid number of infections. This is particularly important to help protect our healthcare system and workers. We covered how to wash your hands in our previous video, along with disinfecting surfaces and not touching your face. However, many of us are now having to physically distance ourselves from others in order to slow the spread of the virus. Here in Los Angeles, I've noticed that some people seem to interpret the rules to mean that they can gather outside or even exercise in crowded places, though that's not within the guidelines of physical distancing. I think a good rule of thumb is to assume that you're a carrier, even if you aren't showing any symptoms. That means that you want to avoid people to the best of your ability and maintain a distance of 6 feet or more from others other than those in your household. Basically, think about how you can avoid spreading the virus to others, even if you don't think you have it. We especially want to protect our most vulnerable in society right now, which includes our senior community. Number 2, donate blood. Blood banks have been hit hard by the pandemic as people have been sheltering at home while blood and platelet donations have gone down. Many people depend on blood and platelets to survive, and it doesn't change just because we're in a pandemic. If you're healthy and meet the criteria, I highly recommend scheduling an appointment with your local Red Cross blood donation center. Some of you might be concerned with exposure to others during the process of donating blood. That's a very reasonable concern, especially given the physical distancing guidelines. Luckily, the Red Cross is also concerned about exposure and has set up enhanced safety protocols that include checking temperatures before allowing donors to enter, wiping and disinfecting all equipment and contact areas, and increasing the space between donor beds to meet physical distancing guidelines. Just keep in mind that the Red Cross does have specific eligibility criteria for donating blood. For example, if you've traveled to any location that's currently a hotspot for COVID-19, then you're likely ineligible to donate blood at this time. Number 3, donate money or supplies. As many of you know, schools have been closed and unemployment is rising. This combination places enormous strain on many households, especially low-income and hourly workers who are trying to provide for their families. If you're fortunate to be employed during this period, I highly recommend donating money or food to your local food bank or soup kitchen. It doesn't have to be a huge donation either. Even $1 or $2 can help feed a family in need. If we all contribute just a little bit, our micro donations can have a macro effect. If you prefer to donate toward medical supplies or support, I highly recommend Relief International, Heart to Heart International, and Doctors Without Borders. These organizations are helping to provide medical supplies and services to healthcare workers around the world. Another option is Global Giving, which is working to raise $5 million toward both medical and food supplies. The bottom line is now is the time to help others, especially if your financial situation is stable. Number 4, help your neighbors. I was so touched when I recently went on nextdoor.com in my local community and saw offers from neighbors to help get groceries or supplies for others. This is especially important for those in our community that are most vulnerable, like our seniors that might not have the resources or ability to prepare. And it's not just our neighbors. Think of the people in your life that you interact with on a regular basis. I bet there's someone who could use your help. Whether it's a grocery run or even moral support, there are so many opportunities within our neighborhoods to help others. Isolation and loneliness are a real problem, and it's only being compounded by this pandemic. Help your neighbors connect and don't wait for those that need help to ask. Be proactive and see how you can help others in your community. And for those of you in this community that are into credit cards and points, I urge you to help those in your life with things like setting up contactless or mobile payments. It may not seem like much, but even reducing one's exposure through the exchange of cash can reduce the risk of infection. compassion. Again, it's these smaller changes that can make a larger impact. Sharing your knowledge, as simple as it sounds, can make a difference. Number 5, volunteer virtually. Perhaps you're stuck at home and wondering if there's a way that you can help without getting additional exposure. The good news is that there are plenty of ways to help. Many organizations like the United Nations and Red Cross need volunteers to help and have roles that are completely virtual. If you have the bandwidth and time, now might be the perfect opportunity to volunteer, even if you have to do it behind a computer. Number 6, support local businesses. The economic impact of the pandemic on our local businesses is devastating. Small businesses need our help. Consider ordering food online to support local restaurants. For other businesses that you might frequent, consider buying gift cards that you can use once the situation settles. Also, think about people in your life that you depend on regularly for services like haircuts or childcare. These folks need our help too. You might consider paying them for work even if they are unable to provide it. On that note, number 7, give generous tips to service workers. Many service workers do not have benefits, so it's important that we try to help them as much as possible. Consider giving a little bit extra to those that may not have paid time off or benefits. Number 8, think of creative ways to connect with others. More than ever, we need to find ways to connect with those in our lives. This pandemic will undoubtedly cause people to feel isolated and depressed. While we may not be able to spend time face to face, it doesn't mean that there aren't options. Luckily, we live during an amazing time when it comes to technology. There's so many free tools that we can use to connect with others, whether it be through video or even through games. Now is definitely the time to use technology to help connect with others, especially when we're all trying to practice physical distancing. For example, one of my best friends and I decided to meet this week for coffee virtually. We set up a time, both made coffee, and dedicated time to chat as if we were meeting at a cafe. Also, Fiona and I had planned to celebrate a friend's birthday this past weekend, but had to cancel due to the pandemic. However, we decided to meet virtually to catch up over a video call. It doesn't replace being there in person, but it's so much better than texting. And I've even heard stories of people hosting game nights virtually with their friends. In fact, both Fiona and I love to play tabletop games, so we're planning to host a games night where we stream a copy of Jackbox games over Zoom. If you haven't tried Fibbage, which is one of the games included in the pack, it's one of my favorite games to play with friends. And just because we're not in the same place doesn't mean that we can't still play and enjoy a games night with our friends. Again, isolation and loneliness are real issues during this pandemic. Help your friends and family stay connected during this tough time. Number 9, use correct terminology. One of the most toxic results of the pandemic has been the misuse of terminology and names to associate the virus with specific people. For example, the Asian community has been the target of many attacks due to the stigma caused by these names. It's important that we fight against the misuse of language and names. Blaming an ethnic group is wrong, hurtful, and counterproductive. And just to illustrate the point even further, the flu pandemic in 1918 is often referred to as the Spanish influenza since the first widespread cases appeared there. Though scientists now believe that the virus originated from farmers in Kansas who were drafted into World War I. They ended up spreading the virus in Europe, which then resulted in a pandemic. Though the Spanish were stigmatized for the outbreak, it didn't actually start there. And looking back, it's clear that viruses capable of a worldwide pandemic can originate anywhere. This is a global issue, and we need to find ways to unite to confront it. That means using the correct terminology like COVID-19 or the novel coronavirus, and confronting those that wish to call it otherwise to blame a specific group. Lastly, number 10, practice kindness and compassion. It's more important than ever that we practice empathy and kinship with one another. These are difficult times and it's easy to focus solely on ourselves, but I would argue that now is the most important time for us to care for one another. The situation is likely going to get worse before it gets better, but it doesn't mean that we can't lead and engage with compassion. How are you all doing during this pandemic? What other ways have you found to help your community? Please share in the comment section below. We hope you enjoyed this video and found it useful. If so, please give us a thumbs up and consider sharing the video with others. It may not seem like much, but it really helps us with growing our channel and community. We hope you all are staying healthy and safe right now. Until next time, travel safe and travel smart.